Basics of medication administration. Perform the 6 rights of medication administration per ATI for each of the 3 med checks: right patient, right medication, right dose, right time and frequency, right route, right documentation. Additional rights include right patient education, right to refuse, right assessment, right evaluation. Basics of medication administration. To promote a culture of safety, nurses must take great responsibility in ensuring medication safety checks are completed during medication administration. Medication Check 1. Check accuracy and completeness of MAR versus prescriber's order and pull the medication. Review the accuracy and completeness of the MAR to verify if the prescribed medication orders are appropriate for the patient. Medication Check 2. Prepare the medication and compare medication label to the MAR. Check expiration date on all medications. Medication Check 3. Check medication to the MAR at the patient's bedside. Calculate the drug dosage if needed, and double-check any high-alert medications. Verify high-alert medications with another RN. The second nurse should do the medication check after the gloves are on and the nurse is pulling the medication into the syringe. The 10 rights of medication administration are: right patient, right medication, right dose, right time and frequency, right route, right documentation, right patient education, right to refuse, right assessment, right evaluation, right patient or client. The Joint Commission requires 2 client identifiers. Verify identification bands for name and identification number. Right medication. Verify medication completeness and clarity of physician order. Right dose. Verify correct medication dose. Check a drug reference guide to ensure the dose is within the recommended range. Ensure medications are prepared using the correct equipment to ensure correct dosages are being prepared. For example, syringes and graduated cups. Right time. Administer medications on time to ensure consistent therapeutic blood level. Administering medications 30 minutes before or after the scheduled time is usually acceptable per drug reference or facilities policy. Critical medications should be given at the time prescribed by the physician. Right route. Medication absorption, distribution, metabolism, and excretion is influenced by the route of administration. Right documentation. Document after medication administration, recording the medication, dose, route, time, patient response, etc. For some medications, such as blood pressure or pain, evaluate the patient's response after administration based on route of administration. Right client education. Educate the patient on the purpose, what to expect, how to take it, and what to report. Right to refuse. Patients can refuse medication. When a patient refuses medication, ensure explanation and consequences are reviewed with the patient. Notify the provider and document the refusal. Perform collection of essential data and assessment prior to medication administration. For example, check the patient's blood pressure before administering blood pressure medication. Right evaluation. Follow up with the patient to verify therapeutic effects as well as assessment of side or adverse effects. High alert medications. Be mindful of high alert medications per facilities policy. Some high alert medications include anticoagulants, anti-diabetic agents, sedatives, and chemotherapy drugs. Depending on facility policy, a second licensed nurse may need to verify the medication through an independent double check. This is because some of the medications that fall under high alert may pose an increased risk of causing an adverse event to patients or clients.